What is anxiety really? Well, it's your body's natural fight or flight response to stress, danger, or perceived threats. It triggers a physical surge of adrenaline and cortisol to help you react quickly. Experiencing occasional anxiety is a normal part of life. We've all experienced anxiety at some times, being anxious about something. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, like a panic attack. These feelings of anxiety and panic interfere with daily activities, difficult to control, are out of proportion to the actual danger, and can last a long time. People may even avoid places, situations, people to prevent these feelings. Symptoms can start in childhood, teen years, and continue right on to adulthood. And there are several types of anxiety disorders um, that exist. Agoraphobia. It's a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Sometimes this can keep you housebound. An anxiety disorder due to a medical condition. Symptoms of intense anxiety or panic that are directly caused by a physical health problem. You know, the worry about a physical health problem can then cause fear and anxiety. Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstances. It's difficult to control and affects how you feel physically. It often occurs along with other anxiety disorders or depression. Panic disorders involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, like panic attacks. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart, like palpitations. These panic attacks may lead to worrying about them happening again or avoiding situations in which where they occurred. Selective mutism is a consistent failure of children to speak in certain situations, such as school. Even when they can speak in other situations, such as at home with close family members, this can interfere with school, work, and social functioning. Separation anxiety disorder is a childhood disorder characterized by anxiety that's excessive for the child's developmental level and related to separation from parents or others who have parental roles. Social anxiety, social phobia, involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self consciousness, or concern about being judged or viewed negatively by others. Specific phobias are characterized by major anxiety when you're exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people also. Substance-induced anxiety disorder is characterized by symptoms of intense anxiety or panic that are a direct result of misusing drugs, taking medications, being exposed to a toxic substance, or withdrawal from. But when to see your doctor? You feel like you're worrying too much and it's interfering with your work, relationship, or other parts of your life. Your fear, worry, or anxiety is upsetting you and it's too difficult to control. You feel depressed, have trouble with alcohol or drug use, or have other mental health concerns along with anxiety. You think your anxiety could be linked to a physical health problem. If you have suicidal thoughts or behaviours, if this is the case, contact your provider straight away or contact a suicide hotline. Your worries may not go away on their own and they may get worse over time if you don't seek help. See a doctor, a therapist, mental health provider before your anxiety gets worse. It's easier to treat if you get help early. Treatment in the UK for anxiety typically begins with self-help resources or NHS talking therapies. If initial therapies are insufficient, your GP may prescribe medication. You can access treatment through a local GP, or you can actually refer yourself directly to NHS talking therapies. Talking therapies is free. It's a psychological intervention. Primarily, they use cognitive behavioural therapy. So you don't need to be referred to that. You can self-refer directly to the NHS. Your GP support and medication. Your GP can assess your symptoms and provide professional guidance. They can prescribe clinically backed medications or short-term beta blockers to physically calm symptoms. Charities and private therapy. Additional support, community groups and private therapists. The charities, explore memberships, support groups, like Anxiety UK even. If you're at all times, if you're in immediate distress and need someone to talk to, dial that NHS, the NHS direct line, or the Samaritans 116123, and they're apparently open 24/7. Coming up next will be causes of anxiety. What are the causes? Like the root issues. What is it that causes us to be anxious? Overly anxious. If you want to join the conversation, you have an experience, you suffer from anxiety, email us, cafesoulpod@gmail.com.